There are certain CAR T-cell therapies that are known to have a higher risk of CRS, depending upon the structure of the CAR T, so we know that. There are ways to give CAR Ts now that the risk of CRS may be reduced, like some of the newer drugs. There's split dosing for some of them, which may reduce CRS. And then in patients, the high-risk patients are patients that come to treatment with bulk disease. They have signs of actually inflammation or fever at the time they get treated, high LDH levels, poorly controlled disease, that kind of stuff. Age is also associated with higher risk of CRS and also higher risk of ICANS. So those kinds of things, but there's no specific red light that you can look at and say, okay, this patient's definitely going to get grade 3 or grade 4 CRS or ICANS. They're just a compilation of factors and features of patients that seem to predict higher risk of CRS and ICANS.